Hello, my name is Skylar Young, and I've been a nurse for 2.5 years with over half my experience being in adolescent inpatient psychiatric care. I first discovered my passion for working with psych patients while working on the med-surg floor at Novant Brunswick Medical Center. It was a common and rewarding experience for me to care for patients with substance abuse disorders and those suffering from mental illness. It was a dream come true when I accepted my current position at Carolina Dunes Behavioral Health. I always knew I wanted to work in healthcare, but was unsure of the role I wanted to play. In order to get some hands-on experience with patients, my first year of college I began working as a phlebotomist. I worked with an amazing primary care physician who encouraged me to look into and consider mid-level provider programs and explain the difference in scope of practice between the options. The more I learned about nursing, it didn't take me long to be inspired and drawn in by its holistic perspective and culture of integrity. After long consideration, I decided to complete an ADM program before returning to UNCW to complete my BSN. This May, I will have reached that goal and will be graduating from UNCW's RN to BSN program. I became inspired to become a Psych NP after working with several incredible nurse practitioners at my current position at Carolina Dunes. Observing their interactions with our psychiatrists, nurses, and patients over the last year and a half has convinced me that this is the only path I want to pursue. NPs have much more complex understanding of the therapeutic and pharmacologic aspects of psychiatric treatment than I currently have as a nurse. While I truly love being a nurse, I feel that this advancement would allow me to reach my ultimate goal of spending my life healing and inciting hope in vulnerable and underserved patient populations. I have built strong therapeutic rapport with most of our residents, allowing further development of my communication skills, such as de-escalation and therapeutic communication. However, one of my weaknesses is that I sometimes find it difficult to be assertive. Over the past year and a half, I've become very confident in my abilities in my current position. I have a clear understanding of scope of practice, excel in providing culturally sensitive care, and always go out of my way to help other team members. I would describe my leadership style as laissez-faire. I have much respect for my fellow team members and trust in their competence and abilities. While I do continue to work on being assertive when necessary, this leadership style seems to work well in my position, being that there is an understanding that we are all capable and will ask for help when needed. My most notable community involvement experience was in 2016 when I spent a total of 39 hours volunteering at the Cape Fear Clinic, which is a nonprofit clinic providing medical and mental health services to low-income patients. As far as research goes, my experience is limited to participation in a quality improvement project while working on the med-surg unit to lower hospital-acquired infections. Basically, every shift someone was secretly assigned to observe and document staff hand hygiene. Data was then posted on our bulletin board monthly to show our results. I am not affiliated with any healthcare organization other than my employer. However, one of my goals in the meantime of working towards my DNP is to become a board-certified psych nurse. I will have enough psychiatric clinical practice hours to be eligible to take the certification exam around August 2023. In nursing school, I was unable to complete my preceptorship in person due to using simulation for an alternative as a COVID precaution. I was terrified working as a brand new nurse who had never even put in an IV to be working night shift on an understaffed med-surg unit during the height of a pandemic. A lot of nights I felt like I was incompetent and the worst nurse in the world, but every day got a little easier. By the time I finished my first year nursing, I was proficient and confident in nearly every nursing skill. It was one of the hardest years of my life, but now I walk into every shift with my head held high, knowing that I am well prepared to handle whatever situation arises, and if I'm not, I will be next time. To conclude this interview, my unique background, goals, and outlook for the future of adolescent psychiatric nursing would contribute to the DNP's program goal of admitting students from a wide variety of backgrounds to enrich the learning experiences of all students. My admission is imperative for me to reach my professional goals, but no matter the outcome of my application, I will continue to strive to improve my clinical practice and become more qualified. Thank you for your time.